Sometimes I have patients that says, for whatever reason, either I don't like needles and I don't want to do needles, or they come to me and say, I just want to start with the laser now. I don't want to do needles. I don't want to do anything else. And I said, okay, perfect. We can do it because it's going to work for sure.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
Hey, Hadar, how's it going? I've been thinking a lot about your state recently. We need to get more podcasts when people coming from Florida.
Yes, we definitely should because, here we get a lot of skin cancer and then people go and they get, surgery and they get effects of aging in general. And one of the most common treatments that people seek are lasers, which are one of the most important tools we have in dermatology and specifically in dermatological surgery. So we thought we'll talk about it today, and bringing a clinician from Florida is the best way to do this. So shall we do it?
Yeah, let's do it. And I love lasers. With my engineering background, I love these tools that help us treat the skin better. So today we have Dr. Lilia Correa-Selm, and she is a board-certified dermatologist. She's an associate professor in the Department of Dermatology at the University of South Florida, and she's also at the Moffitt Cancer Center. Lilia, welcome to the podcast.
Thank you, Hadar. Thank you, Raja. Happy to be here.
Wonderful, Lilia. And I wanted to jump straight into it because a lot of people get confused about what is laser exactly. Can you give us some basic terminology so for the rest of the conversation, everybody's with us?
Yes, absolutely. So it's funny how everybody thinks that laser is just kind of like a word in itself, and nobody thinks that it's actually an acronym, which is kind of like a very interesting thing. So it is, and the acronym is light amplification by stimulated emission of radiation. So everybody thinks that laser is a known word. We would use it like every day, but actually it's once an acronym done by it. What it is a source of energy that actually excites a medium. And then that medium can be either gas, liquid, or solid. And then that kind of produces the laser light. And then that's the gas media is what kind of gives the laser its name. So for example, we have the gas, the CO2, which is a gas media, so the CO2 laser, or we have the copper vapor lasers, which we don't use as much nowadays. Then we have a liquid media, which is probably something we have all heard of, which is the pulsed dye laser. And then we have solid media, which is more like on the words of alexandrite or Nd:YAG lasers, so and erbium. So those are more like on the solid media side. So like I said, they give more or less the name of the laser. It's important that usually what happens with laser is that they emit that light, and then that will go into the tissue and will heat it up and more or less cause destruction of the desired particle that we want to treat. So it's a very interesting technology, if you will.
Yeah, and one of the things I like to do to explain patients is that laser, even though you think about it as light, is actually one of the advantages is the precision and the predictability of it, because everything is very precise. And so you mentioned the concept of being selective in the target that you hit, is it hemoglobin or what have you in the skin? But then there's also that precision. So every time you fire that laser, it gives you exactly what you want it to give. And that is something that is a huge advantage because that can add to the predictability of the outcome, which is what every patient wants to know. Well, how will I look after? What will happen to my skin? And so you can actually be very prescriptive in the way you do this, right?
That is correct. And we actually do have several things that we use to get there, to be very precise and only kind of like target what we want to treat and nothing else around it. I mean, the three targets that we have in the tissue are mostly water, hemoglobin, and melanin. So we base more or less all our treatments in the content that those are in the skin per se. So we use a few things. We use, for example, energy, that it's kind of like the unit that we use to measure what we deliver in the area. And then that energy, when we use it per unit, it's called fluent. So it's kind of like what we deliver, that heat that we deliver. Then we also have what we call pulse duration, which is more or less the time of the laser exposure. So kind of like the width that the tissue is exposed to that beam of the laser. Then we have the spot size, which is the diameter of the laser beam that we use on the skin surface. And then more importantly is actually the chromophore, which is exactly what we're talking about, which is the light absorbing molecule. And like I was saying before, the three targets, which are called chromophores in the skin, are water, hemoglobin, and melanin. So they have what we call a peak absorption, which is the optimal moment when they will absorb that heat that the laser is delivering. And that peak, it's ideal for us to know when we should deliver it and at what wavelength we should deliver, so that can be exact, like you were saying before. And then most importantly, we work in something called selective photothermolysis, which is a principle that gives us the laser parameters. So that uses three components. So one is the wavelength of the laser, like I was saying before. So those kind of like those areas that we have those chromophore absorbing, it's kind of like that wavelength is what we want to hit with the laser, the wavelength with their highest absorption. Then we have the pulse, which is delivered, and then it must be short enough to affect the target without giving that heat to the adjacent tissue. So it has to be small enough to hit the target, but not too big so that it doesn't hit the adjacent structures. And then last but not least, like I said, the fluence, which is kind of like the heat that we're delivering that is enough to have a treatment effect, but less than the energy that can cause damage to the surrounding tissues.
Well, Lilia, this is a wonderful tour. Actually, you were able to summarize
Yeah,
pretty
no,
much all
I
the
love it.
principles we need to know very quickly. So now we get to the good stuff, which is, what do lasers actually do? What are the most common things that dermatologists will treat with lasers?
Yeah, so obviously there are a lot of things you can do with them. So the probably the one of the most common things to use is laser hair removal, which it's widespread use right now and a lot of people do it. And it's, here the chromophore will be more or less the melanin within the hair follicle. And usually, because as we all know, the hair has like a 3-month cycle, and when we do hit the hair with the laser, sometimes the follicles that are in anagen won't be affected, or sorry, intelligent. The ones that are in anagen will be affected, not the ones intelligent. So we have to do anywhere from 4 to 6 sessions to kind of hit all of the follicles or the majority of the follicles that we want. And like I tell my patients, you do those 6 sessions with about 4 to 6 weeks in between, and then you will have hair for about a year or two sometimes. But there will always be some little bit that will come off. So that's why we now call it hair reduction and not hair removal. And then you do 1 or 2 sessions of maintenance throughout, and then that will keep the patients pretty hairless for a long time. Then we have the tattoos, which we can remove with lasers. And this is obviously a much more complicated area. You will have to pick the laser depending on the color, because now the chromophore will be actually the particles of ink that are in the dermis. So depending on the color of those ink, we can pick which laser we need. And so obviously the ones that are less colorful are the easier to treat. Like those that are all black, that are done by like artisanal and not really artists, are much easier. The ones that are much more colorful are harder to treat. And on the same token, those that have like mixed inks, like sometimes tattoo artists mix the inks to look prettier, so those are very hard to treat. And then obviously, depending on the size of the particle of the ink, will also dictate what type of energy we're gonna put into that tattoo. Then we have pigmented lesions, which are more like cafe au lait, epidermal nevus, dermal nevus, and like all dermal, kind of sometimes melasma. You can also use some lasers to treat. Then there are vascular lesions, so like hemangiomas, telangiectasias, specific vascular lesions, like for example, port wine stains. And this kind of it's one of my favorite ones because sometimes when I'm treating the telangiectasias on the face, for example, you hit it with a laser and they essentially disappear. So I joke with my residents that it's kind of like playing laser tag with the telangiectasia. So it's kind of fun. It's a very satisfying result. Then you can also treat stretch marks, and you can obviously treat photoaging, which we all know because you heat up the dermal part of the tissue, and that will certainly tighten up and get rid of the fine and sometimes even deeper creases. And last but not least, you can treat scars, which is one of the things I do most as a Mohs surgeon. I do create scars. And, I would say probably 95 to 98% of the times they look amazing. But on those little percentages, which they don't, I like to use the laser to treat them.
That's wonderful. And definitely the use of lasers has exploded. I mean, there's so many different ways to apply that technology. Even in dermatology, there's also a drug delivery where you can create conduits in the skin and apply medications. And people really got creative with this and combining different lasers, which I think scars are probably one of the best examples for various lasers. But I want to pause for a second and acknowledge this amazing fact that you're actually a surgeon, but are using lasers to benefit your patients because, and I can tell you this, and I tell every patient, any surgery will create a scar. We don't know how to regenerate skin. We only know how to repair it. And so everything will create a scar. Now, some scars are nicer, some scars are not so nice, but definitely everybody creates scars. So, I think having a laser is really a nice way to complement your practice, whatever you do, but definitely if you're a surgeon. So, I want to maybe ask you now specifically about scars. What kind of lasers do we use and what do we target when we look at scars?
Yeah, so very good point. There are three things that we usually target within a scar: color, any vessels that could be there, and the texture or kind of like unevenness on the scar. So for the color, they can be either red or hyperpigmented. They obviously can be hypopigmented, which is a little bit more challenging. And then usually for that, the laser I use is the pulse dye laser because it targets redness and a hyperpigmentation really well. And even though when I was starting using my laser, the typical thing they teach you is like, well, those are the only two things you'll be able to target because you're targeting the hemoglobin and the melanin. The hypopigmented scars, you don't have much to target there. Well, it happens to be that when I started using my laser and the scars start contracting because you're using your laser, the hypopigmented area can actually also get better. So now I tell my patients, I won't promise you that, but it can happen. Then secondarily, we'll treat the vessels on it, which will do the same thing that we use on vascular lesion and telangiectasias. So we'll treat that the same way I use the pulse eye laser, but you can use KTP, you can use Nd:YAG as well. So any laser that will target, hemoglobin. And then last but not least, it will be like the consistency of the scar or how uneven it is. So the pulse dye laser works well if the scar has color, but if the scar is just more or less skin color, the gold standard for that type of laser will be a CO2. So the CO2 will treat it in 1 or 2 sessions, like all the steps down of the scars, or if it looks a little bit different than the rest of the skin.
Wow, that's really great, Lilia. And I wanted to ask you, since you're on the topic of CO2 and just these ablative lasers, can you differentiate for us the CO2 versus maybe something like the erbium? What's the difference between the two, and how can they be used differently, say, on skin of color or darker pigmentation versus not?
Sure. So obviously, like I said before, the main difference of it is the medium. So the CO2 has gas medium, which is the CO2, carbon dioxide, and the erbium has a solid medium, which is the erbium. Then after that, depending on that, because they have different targets. So the CO2 targets mostly water, The erbium targets mostly pigmentation, so you can use them differently. Like, for example, the erbium, depending if it's ablative or not ablative, you use it more like for dark spots, or you can use it for photorejuvenation, versus the CO2 doesn't target pigment as well. It's more for like unevenness or for photorejuvenation, because it goes more deeper onto the water medium. And then, as you mentioned, more like pigmented skin, like the better laser for that will be the Nd:YAG, because it's a laser that the wavelengths make it go deeper. It's a 1069 wavelength. So it kind of passes by the real pigmentation of the skin, which is, as we all know, in the dermal-epidermal junction. So it goes directly to the dermis. So it's pretty safe in darker skin colors. And that's the one we should use in phototypes 4 to 6. Like, for example, if we want to do a laser hair reduction or we want to remove a tattoo. So ideally, that's the most important laser that we should use.
Thank you. That was excellent. I wanted to go back to the scars. Some patients complain about pain or itch in the scar. Do lasers help with that as well?
Absolutely. Actually, once you start treating the scar, because you are remodeling that type of tissue, it gets all those kind of like healing process that happens. The laser accelerates it and makes those symptoms reduced. So it doesn't only improves the appearance of the scar, but it also improves the symptoms, which more often than not, sometimes patients, that's what they complain about. So it also serves like as a therapeutic measure for those things.
No, that's wonderful. And I think patients really like to hear that. Speaking of the patients, I wanted to ask you along the lines of the art and practice of medicine, how do you bring up a conversation about laser to the patients? Because I know there's a lot of concerns, right? People are afraid that it's going to hurt, for example, or it's going to leave some marks, or they may have too many expectations, right? They think the scar is going to completely disappear and they're going to have again baby skin as if they were born yesterday. So, how do you address their concerns about pain and discomfort during the treatment on one hand, and how do you manage expectations to make sure that they actually get what they want?
Absolutely. So with pain, I think that's really an important point to address with the patients, because like one of my teachers used to say, he's like, you don't want to cause pain on your patients because they won't come back to your practice. So you want them to have a pleasant, somewhat pleasant experience as much as possible so that they keep coming back to you, especially in this type of treatments where they're, for the most part, doing it cosmetically and it's kind of like an option and they have a choice of not doing it. So in this case, you want to make sure that they have a positive experience. So first of all, the pain. So I try to give them a little bit of a heads up of what they're going to feel. And I try to describe it in the best way I can. So for example, there are lasers that are more like a little rubber band snapping. There are other lasers that are painless if you use it with low fluence, and you're just going to feel a little bit of an effect of the Zimmer, which is the very cool spray that we put on it so that they don't feel it. So I try to describe that to them, so because that can actually make them a little bit like unease if they don't know what to expect. And then some of them is just the light. For example, when we use the IP, the intense pulse light, which is not a laser, we can talk about a little bit about it. So it's a very intense light. It doesn't, sometimes it uses low enough, it doesn't hurt, but the patients can be scared by it. So I tell them ahead of time, this is a very strong light. And I actually tell them it's kind of like as a welding light so that they are not scared by it. I start my treatments in the low setting possible that I know it's going to improve, but it's not going to hurt. We can always go higher. And I feel that eases the patient into the procedure. And then the second or third visit they come, they're pretty comfortable. They're like, oh, well, it was not uncomfortable. It was fine. So I ask them, so listen, I think I want to go higher. What do you think? And they're kind of like participate in that decision process. So when I know it's going to start being uncomfortable, then I offer them. So first I do topicals. I do topical lidocaine or other formulations that I compound for them. Or secondarily, for example, in tattoo removal, which can be painful, even on the first session, I consider numbing with local lidocaine because they can be truly painful. And then how to manage the expectations. So that's also a very, very important point, especially because a lot of these patients are paying out of pocket. So obviously they want to know exactly what they're paying for. So I want to give them full spectrum of what they're going to wait or what we're going to expect for that treatment. And I don't want them to have false expectations that are going to happen. So the first thing I tell them is, I'm not going to give you your skin back before this procedure. So in other words, like, as awesome as I am, you will still be looking at something there. Now, if they end up with perfect result, they're going to be pretty happy. But more often than not, that's not the case. So I try to make sure they know that. And then I describe step by step the things that we're working on. So I tell them, well, the first things you're going to see is the scar is going to be, for example, if I treated pulse side laser, it's going to be purple for X amount of days. Then you're going to start seeing that it's going to fade off. Or for example, if I use a laser like the erbium that sometimes can cross a little bit of in the CO2, I tell them you're going to see some cross there. Please don't pick it. Then you're going to start seeing how it just starts like healing up. So I start like kind of like driving them through all the days and the weeks that are going to be after the procedure, so that they are not scared, and when they see it, they get more reassured of what to expect for. And then after that, I say, well, after the first treatment, you expect to see this. After the second treatment, you expect to see this. So they're more reassured as they go into it instead of being disappointed often.
That's wonderful and a great overview. Wow, a load of tips. One of the other
Yeah,
things
no
that,
kidding. Lilia, you're on fire.
yeah, that's incredible. One of the other things that I think as you get more experience, you can start collecting photographs of your patients before and after, and then showing patients some of the immediately post therapy and having testimonials, and then showing them the results after can sometimes help. Talking about that issue of pain during the treatment brings up an interesting point. We love integrative medicine. And I think during surgery, a lot of times we like to use various integrative approaches to put the patient at ease, maybe help some of the pain. And I find in lasers, it's a little challenging. What do I mean by that? So I like to play music during surgery, but laser is so loud, right? Or we have shown that you can use virtual reality, these goggles you put on patients' face, and they kind of transforms them to a different location to ease the pain of procedures. But again, most laser is done on the face. And so I'm wondering, I think that there's other interventions that people can use. For example, breathing exercises can help a lot of times, and there's a slew of them, but I think helping patients to maybe kind of calm down, it can definitely slow down the heart rate and allow them to handle the pain a little better. Even some aromatherapy can help as well. Do you use any of these little tricks or alternative or integrative approaches to enhance the patient experience?
Yeah, so I may start using some of those things. So I do a fair amount of procedures in children. So I have a wonderful pediatric dermatologist in our department, but she's not big on procedures. And I feel pretty comfortable with kids. So I do mostly the majority of her procedures as well as devices, obviously. So in procedures, like you said, for me, like tablets and musics are like king, because I turn that on and the kid literally doesn't even know what I'm doing, which I cannot do on the laser because they have to wear goggles, right? So I have to protect their eyesight. We didn't even talk about that. So with lasers, we have to put special goggles because otherwise that laser can damage the eyes in different areas. So needless to say, they're going to have goggles on, so that's not possible. So one technique that I do, which is what I also do in my surgeries, is try to start talking with them. So, so what do you like? What do you do this weekend? What are the things you do? So try to give them a little bit of a distraction out of it. In the ones that like to hear music, I tell them, wear your earbuds, because even though my laser is loud, if they have earbuds, then they hear less of what I'm doing. So that's also another tip that I do with them. I should probably start doing some of the tips you just gave me. Then I'm going to probably do a little bit of aromatherapy. That's a great idea. Or, happy to hear what other things you do, and I can incorporate it in my practice.
Is this more around pain or itching?
We're talking about pain during the procedure and distractive methods or anything
Oh
that you can
gosh,
add.
I like to do a lot of breathing exercises. And I don't know if you include this, Lilia, but I usually just have them go through like a deep breathing cycle just to kind of put them into a parasympathetic state so they're not as anxious, and I really make it a point for them to breathe out during the first injection and then focus on counting. I usually do something really like, some bad math that makes it really tough on them. So like I tell them to subtract 13, some prime number from 1,000. Of course, they're all mixed up trying to do the math, and then we're done with the numbing pretty quickly. Some people are like, I hate math, man. Don't ask me math questions. I'm like, perfect. I want
That's
you to
great.
towards me, not towards the needle.
That is a great tip. I hate math and I can totally identify with what you said. So I think I'm going to start doing that.
Well, you've got to be good at some amount of math, man. You know these lasers back and forth. So you got some
Now,
of it down for sure. Since you do a lot of surgery and we're talking about pain, I guess I do have a question for you. Post-operatively, when people have a lot of pain, do you think there's a role for things like topical CBD or naltrexone, or are there any sort of modalities that you counsel people through, especially if they're like, hey, I don't want any opioids, even if it's temporary, or I don't want to take Tylenol or, ibuprofen? Are there other modalities that helps them with maybe not the acute pain, but sometimes there's this chronic itch/pain that kind of develops?
That's a very good question. Also, as a Mohs surgeon, I deal a lot with pain post-op, obviously. There are studies that actually show that NSAIDs alternated with acetaminophen post-op versus opioids are much more effective than the opioids actually. So there is this particular study that they did for 3 days post-op, and the patients that were doing the combination of NSAIDs plus Tylenol had less pain than the opioids. So I always quote that study when the patients ask me this question, because actually what I'm giving you is more effective, but it has evidence. Now, in terms of like topicals, full disclosure, I haven't tried any topical naltrexone or CBD, but I'm a big proponent of topical lidocaine, to be honest. So if they are in pain, that's one of the things I dig out a lot into it. Like especially with laser, sometimes like the surface is not the deep pain from surgery, right? It's more like the deep pain on the epidermis and a little bit of the upper dermis. So I feel like lidocaine is a really good adjunct for it, because obviously when you're deep, the lidocaine is not going to penetrate enough, but in these cases it does. So I'm a huge advocate and proponent of topical lidocaine, but I know you guys have much more experience in like the alternative use of topicals. I've heard some of your podcasts and they're amazing. So I'm open to hear what you guys tap into on your practice.
I think when it comes to wound care, what I've seen that can be helpful is things that can reduce the tension. I mean, maybe that's not so, quote, integrative, but, there's been ways to create more back tension. There's been this thing called gecko tape that helps to offload, especially on the upper back and whatnot. But, to go back to the laser question, say someone's getting a hypertrophic scar. You've tried all of these things, they get a hypertrophic scar. At what point do you do these steroid injections? And then at what point do you start doing something that's addressing the vascularity within the scar?
Excellent question. So, to your point, it's going to depend how their scar looks, right? So, if it's a hypertrophic scar that is very red, usually they respond really well to intralesional steroids. So I tell my patients, listen, let's try this first. And I also do high potency steroids in between the injections because I found that they help. And for the patients, it's pretty easy to do like every day. And I see them pretty often. I see them every 3 to 4 weeks just to make sure there is not like additional atrophy around it. And then there are like kind of like two breaking points on that treatment. So one is when I feel like I have reached the maximum effect with the intralesional Kenalog in terms of hypertrophy, or they are already flat enough that I know the steroids not gonna do much, but I just have left only color. So on those two cases is when I just start tapping into lasers. So and obviously it's gonna depend also on the patient. Sometimes I have patients that says for whatever reason either I don't like needles and I don't want to do needles, or they come to me and say I just want to start with the laser now. I don't want to do needles. I don't want to do anything else. And I said, okay, I mean, perfect. We can do it because it's gonna work for sure. But sometimes, like I said, obviously that's not cheap treatments. It's out of pocket, and with intralesionals, we can certainly sometimes fix a lot of the scar.
Well, Lilia, listen, I think we could be talking about lasers and procedures forever, but I want to thank you for taking us through an awesome summary of lasers. Actually, it was more than a summary. You really got into the details in a very effective way. You must love educating because it really shows. And I just want to thank you for spending time on the podcast with us today.
Well, thank you, Raja and Hadar. You guys are amazing. I'm a big fan and groupie of your podcast. I really like it. And yeah, I mean, I'm a teacher, so I do love to teach and I love what I do. So I'm very passionate about all the things I do. So thank you for having me. It was a pleasure.
Guess what, Hadar?
What?
Tickets are selling so fast for the 6th Annual Integrative Dermatology Symposium.
Really? Wow, that's amazing. I mean, each time this event gets better and better.
Yes, it does. And as a special gift to our podcast listeners, all of you, we're offering 15% off registration using the code PODCAST15.
Podcast15 for 15% off. That's a great deal. And prices won't be going any lower this year, so hurry up and get that discount.
So true. And if you haven't joined us in person yet, we can't wait to see you. And this is the year to come have fun at the Grand Casino Resort in Reno, Nevada.
Yes, we are excited to see you, and together with Raja and myself and other practitioners, you will get to connect with everybody, engage with the exciting research and content, and learn what the integrative movement is all about as we get inspired by the Sierra Nevada mountain range and, my friend, downtown Reno.
All that nestling sounds fantastic. Dad joke alert, maybe even skin-tastic. I know we're all about having fun at the symposium, but this year's over the top. Now, I'm not much of a golfer, but for you golfers out there, they have over 40 courses, but they also have rock climbing, equestrian trails, boat tours, pools, arcades, and so much more to just relax.
Oh my gosh, this definitely sounds like a family-friendly getaway. I know I'm bringing the kids. And while they're at the movies, Raja, you and I, my friend, no pun intended here, but we'll be feasting on a lot of nutrition.
That's right. This year's theme has been long awaited. Nourish the gut, nourish the skin, and we'll be delving into nutrition.
Oh my gosh, we can't wait to see you. Come be with us at the IDS on October 27th to the 29th, in person or virtually. See you in Reno.